You just hit play on 10-Minute Tech Talks, business insights and growth hacks for the time-crunched entrepreneur. And I'm Jonathan Kersting with the Pittsburgh Technology Council and Tech Vibe Radio, where I have nearly 3 decades telling the stories of Pittsburgh's most successful tech companies and the women and men behind them. Are skyrocketing medical costs and confusing benefit plans draining your budget and frustrating your employees? Well, you're not alone. Commercial healthcare costs are rising 9 to 10% annually, and traditional high-deductible plans rarely deliver the promised savings. This episode of 10-Minute Tech Talks explores Highmark's bold new CopayGo plan, designed to simplify benefits and bring real transparency to what care costs before you actually get it. I talked to Highmark leaders Jonathan Majernik and Taylor Mackay for the Health Care Reinvented podcast series, so you can understand how CopayGo removes deductibles and coinsurance so members see a single, clear copay upfront. Learn how a national network with tiered high-impact specialties can help control 60% of medical spend without limiting options. And discover how Highmark's enhanced digital tools empower employees to make confident, informed healthcare choices. So press play now to hear how CopayGo can help you rein in rising costs and give your workforce a simpler, smarter healthcare experience. If you got more time on your hands, click on the full episode in the description for all the details. Let's get into the conversation right now with Jonathan Majernik.
I think it comes back, honestly, to the current healthcare landscape. Quite frankly, the medical costs that we're seeing are just unsustainable, for our employers, and that naturally trickles down to the members that we serve as a result. I just saw a recent McKinsey study. They're projecting 9 to 10% annual commercial cost growth through 2026. As I'm meeting with my national account customers, I'm seeing that. I'm seeing medical year-over-year trends in the low to mid-teens. It's unsustainable, and our employers need help. And there's a lot of reasons for that, right? We talked about GLP-1s, we talked about specialty, claims, we talked about high cost claims. And, there is still that, pent-up demand from the early pandemic years. There's elective procedures, the preventive screenings that got delayed or skipped. We're still seeing those come through that are bringing some additional, costs into the system. And what I'm excited is that CopayGo is what our employers need. It's bold, it's innovative, it's exciting, and I think it addresses what this inherent need is. I'm going to let Taylor here in a moment really kind of give that first pass, but I think what I'm excited for is, as Taylor pointed out in his introduction, it is based in simplicity and in the benefit design. It allows for a level of predictability and a level of confidence for our members to have in cost for procedures and their cost share. It taps into real-time transparency and that data that we've really never had, and ultimately is wrapped around a really cool, sophisticated member digital experience that we're super excited for. So Taylor, maybe you can take a little click down and walk through.
Keep us going, man.
The CopayGo itself, if you wouldn't mind.
So taking a big step back, I'm going to use something that a colleague of mine says about CopayGo, thinking of it as a stool, right? There's 3 legs to that stool, 3 key components of it, and then wanted to kind of dive into each of those components to provide some context as to what exactly we're doing with CopayGo. So those 3 legs, right? It's going to be benefit design, it's going to be network, and it's going to be enhanced digital experience. So at its simplest form, CopayGo is a copay-only plan with a national provider network. Getting back to what was mentioned earlier about health literacy, right, and trying to create simplified plans, what we've done through a variety of different research, we've identified some of those complex elements associated with benefit design, namely deductibles and coinsurance. And in order to better empower members, we have removed those. We've eliminated them so members will have first dollar coverage and improve transparency through that copay-only design. The hope is that that helps empower them and helps them easily know before they go and get that care how much something is going to cost. Getting back to how we shop around today, that's a huge benefit and a huge need, right? You need to know how much something is going to cost before you can make a decision and feel confident with that decision. One of the things with regards to the network, which was another leg of that stool, right,
Yes.
is that we're looking at a national network. And unlike a narrow network that eliminates the number of options that might be available to a member, CopayGo takes a different approach, right? So we're looking at tiering 20 high impact specialties that does include primary care. So this means basically those providers that were in the network to begin with will continue to be there, but through the tiering, what we're doing is we're helping members better identify those high value care options. And you might be wondering, like, why are we focusing on those 20 high impact specialties? Well, the reality is those providers sit at a very pivotal point in the member journey. They're not only impacting the care that they're going to be delivered in their office, but they're going to be impacting all that care that's being delivered downstream. And as a result of where they sit in that member journey and the care that is managed through them, that actually accounts for about 60% of medical spend.
Wow.
So
Okay,
by
that makes
focusing on
total
those,
sense. That's where you're going with this because that just
yeah.
it's a
So by,
big chunk right there. Yeah, I
by
love that.
focusing on those impacts, high impact specialties, you're able to manage a very significant portion of the medical spend. And then to complement the design, right, that third leg of the stool, we've made several enhancements to My Highmark, right, which is the website, the app that our members are going to be using in order to better understand their benefits and then also identify care options, compare costs, make those decisions about what's the next step they're going to take in their healthcare journey.
I am so stoked that you made 10-minute Tech Talks part of your day. I hope you learned something new and valuable. And if you want to keep getting more business building, technology, and entrepreneurial insights, just subscribe. We're pushing out new interviews at least once per week. I hope to see you on the next one.